when you come in Thursday with your checkoff, you're going to receive a doctor's order followed by a mark, okay? You'll have already looked up all those drugs, okay? She's going to go over with you exactly what you're going to look up about them. And then you'll come in and we'll go, the first thing we're going to do is ask you, can you tell me the patient's fibroids? How many times are you going to check her medications before you administer them, okay? And we'll set you up. We'll let you get all your stuff ready to give medications, and then we'll go over all that, okay? But I'm gonna start with the lower part of your checkoff, which is just all the topical medications and how you would correctly administer them. I'll have them set out at every station, not until you check off, okay? Y'all can practice at home on your own stuff. You can use M&Ms even to practice giving medications, except you'll probably eat them all as y'all go through.
Isn't that how it's supposed to be? Like one for you, one for me?
Yeah, there you go. That's right. Okay, so let me start with how, and then we'll verbally just ask you this, and you'll give us the answer. So I'm going to say, Casey, how do you administer eye drops? And I want you to tell me that you're going to first clean the eye from inner canthus to outer canthus, okay, to make sure it's clean before you administer it. That you're going to make sure that you have the correct medication and that it says ophthalmic and not otic. Okay, that's very important. They look so similar, guys. So make sure that it says ophthalmic drops. We're going to have them probably in a mid-Fowler's or low Fowler's position, turning their head. If I'm giving drops in the left eye, I'm going to turn their head in this direction. I'm going to pull down that conjunctival sac, okay, and do the sneak attack and administer the amount of drops I'm supposed to. Not directly, I'm not going to put my drops directly onto the eye, but I'm going to let go and instruct my patient to blink, blink, blink to disperse the medication. I'm going to give them a tissue to wipe up any medication that slipped outside of the eye. If I have to give more than one drop, that means 2 different drops, I'm going to wait 5 minutes between each drop. If I have to administer eye ointment, I would always administer the eye drops first. If I'm going to administer the ointment, I'm going to put a thin margin on this conjunctival sac here, right down here on a thin margin from inner canthus out, preferably at night, because it is going to affect their vision, okay? All right, let me see what is next. Eardrops. I'm going to make sure that it is room temperature. I would never put cold eardrops into my patient. They need to at least have their head in this position, if not lying down. I'm going to have to manipulate the ear to whether it's a child or an adult to straighten out the auditory canal. So I'm going to pull it back and down for a child, back and up for an adult. I do not drop my drops directly onto the eardrum. I let them slide down the auditory canal into the airway passage, okay? And if the medication is sitting there, I can manipulate the ear, press on the tragus to get the medication into the ear, okay? I want them to stay in this position at least 5 minutes so the medication stays in the ear. Then I can put a loose cotton ball in the patient's ear. If I have to administer otic medication in the opposite ear, I have to wait 15 minutes before I move them, okay? Nasal spray. Remember, if it's a nasal drop that I want it to go into the sinus cavity, I'm going to hyperextend their neck, put a towel under their neck, like a neck roll, and administer the drops. Oh, after I have them blow their nose, okay? And I would have them stay in that position 5 to 10 minutes. And then instruct them, I didn't mention this before, we don't want them to blow their nose for at least 10 minutes after we administer the medication, okay? Now sometimes they have to sneeze when we give them this, and that's, we can't help that. But we do not want them to blow their nose after we administer this, okay? Nasal spray. Make sure I keep this clean, have them blow their nose. They'll be they'll be sitting straight up. We're gonna shake the bottle, prime the bottle, have them occlude one nostril, put this in their other nostril, and as they press down on this, they inhale. switch sides. All right, so that's how we do that. Inhalers. You know, if we need a spacer, we'll use it. If we have a pediatric patient or an elderly patient, yes.
Back to the nasal spray. Would we
No, most of
action
the time,
it, or will they action it?
they will.
Okay.
If you have a
Somebody that can do it.
cognitively impaired patient, you will do it for them.
Okay.
And that's really hard because they won't
Gotta
understand
coordinate,
how to
right.
inhale, okay, or inhale.
Yeah, okay.
But most of the time, our patients do it themselves, okay? They like to do it themselves. Inhaler, the same thing, they'll do it themselves. Pediatric patients are cognitively impaired, or patients that we believe are swallowing the medication when we want them to inhale it, we're gonna use a spacer. Otherwise, we're going to have them, we're gonna shake this up, remove the cap, prime it, okay? We're gonna instruct our patient to inhale, exhale through pursed lips, okay? Then they're gonna put this in their mouth. They're going to inhale as they press down on the canister, inhale over 3 to 5 seconds, hold it for up to 10 seconds, as long as they can, then exhale through pursed lips. Then we wait 1 full minute before we administer the second puff. Then remind them, do some teaching, that this patient needs to rinse the mouthpiece, rinse their mouth out with water to prevent cavities, and to once a week wash this with soap and water, and to check to see how much medication is in it. We put it in a sink of water. If it floats, it's empty. If it sinks, we've got medicine. Okay. Now some inhalers do list that they have the number of doses in the inhaler, so you know exactly how much you have. Also, teaching with the inhaler, expect that it's going to increase their heart rate and their blood pressure. So we might need, if this is already a problem with the patient, we might need to assess their blood pressure and heart rate before, and then again afterwards, okay? If I had to give 2 inhalers, if I'm given a bronchodilator and a steroid, I always want to give the bronchodilator first to open up the lungs so that the steroid can get into the lungs, okay?
How long
Vaginal?
do you wait between those 2?
You can give them immediately, yeah. Actually, you want to give it immediately. Good question, Caitlin, because we've just opened up the lungs. That's when we want to get that steroid in there. So do it right behind each other. Okay, vaginal suppository. Preferably at night, just like just like the eye ointment. Okay, we want them to be recumbent, which means we want them to be in that lying position 30 minutes or longer after we administer a vaginal cream or a suppository. So we want to do it at bedtime. We want to ask females to go use the restroom first, okay? We want them to void so they don't have to get up again after we've given this suppository or ointment or vaginal cream. So have them go to the bathroom, put them in that dorsal recumbent position. We're going to wear gloves. Of course, we would do pericare if needed. We always have to say that. We would put lubricate our suppository if it's a suppository we're giving. We insert it with our index finger, okay, if it's a suppository. I know that shows the applicator, but most suppositories we do digitally, okay. 2 to 4 inches. We want them to stay recumbent at least 30 minutes, if not longer. If we're using a cream and an applicator, we put the cream in the applicator. We lubricate the applicator, okay. We insert 2 to 4 inches, insert all of the cream and come out. Then we clean our applicator, okay. Rectal suppository. We want to put them in the Sims position. We want to inspect our rectal area first, make sure they don't have fissures, hemorrhoids. We're going to use extra lubricant if they do have that. We might need to do pericare, okay? We're going to wear gloves. We're going to lubricate our suppository, taking it, the bullet end goes in first. We're going to insert in an adult with our index finger past the anal sphincter. And we want them to stay in this position 10 minutes. If it is a child, remember, a child or an infant, we're going to use our pinky finger, especially gentlemen, okay? Gentlemen have larger hands, so use your pinky finger, go in, and we're going to hold the buttocks together, all right? So that to make sure that the infants don't push it back out. All right, medication patch, like a blood pressure patch. We first find the other one. We remove it. Usually we use this upper chest, upper shoulder or chest area or the arm. We remove the old patch, wash that area with soap and water and dry it. We're going to select an area close to where that patch was. We're not going to move from this shoulder to this shoulder and then back to this shoulder. Okay, we're going to use the whole area, then move to another area. When you put your new patch on, wear gloves. Before you put it on, you're going to put, and some of them are small, guys, you're going to put your initials, date, and time. That's very important, okay, that we know exactly when the last patch was put on and who did it. So put your initials, date, and time on that. Make sure you let your patients know that it's going to take 30 minutes before it starts working, and after we remove it, how long does it continue to work? 30 minutes, okay? All right. Paste, applying the paste or a cream or a lotion. We wear gloves, all right, to apply any lotion or cream. If it is a nitroglycerin paste, we would put it on, it comes on a paper that has the numbers on it, that we squeeze out the paste to the exact amount the doctor has ordered. We're always going to put it on a non-hairy portion of the arm, on the inside of the forearm, after we have washed it with soap and water and dried it. So we have gloves on, we apply the paper. We're going to cover that with tape, secure it well with tape, or use saran wrap. And we really do use saran wrap, guys, from a kitchen, to make sure that that stays on the patient and where it doesn't leak out and get on someone else, okay? And then there's also time restraints for that. It's usually left on anywhere from 8 to 12 hours, and then we don't put another one on for 10 hours, okay? So that's how we apply that. I'll talk about assessments we do when I talk about PO meds. Okay, that's that portion, okay? Now, let me move all this out of the way, and we're gonna go over how to give PO meds. And this might make more sense tomorrow when she gives you your MAR and tells you what to do, okay? I'm going to have you, so when you give your oral medications, you're going to have your MAR. It's on the front page, it's the doctor's order. We check our medications 3 times before we give them. So I'm first going to tell my instructor what my patient's 5 rights are, and I'm going to say, I'm going to make sure I have the right patient, the right drug, the right dose, the right route, the right time. My patient also has the right to refuse. I have to do the right documentation, and the patient has the right to know what I'm giving them, okay? So I will check my doctor's order against my MAR to make sure it was transcribed correctly. That's the first thing I'm going to do. And that's really, if you're being tested on NCLEX about the 3 times that you check your medications, your NCLEX is going to say your first check of your medications is your doctor's order to your MAR. That's your first check. However, and this is confusing, I know, in nursing school, a lot of you won't see the original doctor's order. You will just get a MAR, okay? So the second check, I'm going to start my medications. I always go, I do not come here in my medications and find them and say, okay, I have Colace, and then I look for Colace on my MAR. I do not do that. I start on my MAR so that I don't miss something, and I go straight down my MAR, okay? So I'm going to start with the first medication, Zofran, 4 milligrams, 1 tablet, Q-Day. I'm going to find my Zofran, and so y'all will have your medications in this little Ziploc. You'll empty it out, and you'll look for your medication. So let's say this is Zofran. And I'm going to read again. All right, this says 4 milligrams of Zofran, this is 4, and I'm going to put it beside my MAR, beside the time that I'm supposed to give it. My next medication, Vasitec, 10 milligrams, 1 tab every day. So I find it, and I lay it out beside my medication, and I go down my MAR, just finding my meds and making sure this says what this says. This milligram matches this milligram. When I have them all out next to each other, now I'm ready to get my cup out. I'm going to set my cups here, and I'm going to, with my instructor, talk about what these are and if I need to do any assessments with these medications, okay? Zofran, once again, this says 4 milligrams, this says 4 milligrams. So I'm gonna put that in my cup. My next one, Vasitec, 10 milligrams, this says 10 milligrams. I'm gonna put this one in a separate cup because it is a blood pressure medication. So I need to do an assessment. What do I need to check? I need to check their blood pressure. So that's going in a separate cup. That's to remind me, hello, you need to do an assessment when you get there. And if I were you, I would take my pen and right beside Vasitec, check BP, so that when you get in the room to give the medications, you'll remember when you get to that drug, oh yes, I've got to check that blood pressure before I give it, okay? Because if you do not do your assessments before you give this medication, you fail the skill. Because should you give a heart medication that lowers the heart rate if your heart rate was 40 and you didn't check it? No, okay? My next one, all right, and so I'm checking these again, and again, if they have an assessment, they're going into a separate cup, and I'm gonna write, check blood pressure, check heart rate, okay? If I have potassium, if I've got to give potassium, do I have an assessment for potassium?
Yes.
Does potassium have a level?
Oh, yeah.
Yes, and I gave it to you today, okay? You have to know what the normal level of potassium is. It's 3.5 to 5. So, and this confuses some students, so I wanna say this one's specifically for you. If your potassium level that you checked in your patient's chart is 6, should you give that medication?
No.
No, it's too high. We're gonna hold it, and we're gonna circle it and say hold potassium level 6. That's our explanation. But here's what students do. Let's say, I'll say, your potassium level is 2.5. And they'll say, well then I'm gonna hold it because that's abnormal. No, we don't withhold it, it's too low. They need their potassium. So don't make that mistake, okay? If it's too high, we withhold it. If it's too low, we're giving it when they need it, okay? All right, so I've got all my meds. I've gone through my second check here with my instructor before I enter the room. Now I'm going to the room, okay? So when I get to the room, I've already told my instructor all my patient's rights, and I've told him how many times I'm gonna check the meds. I've checked them twice so far. I'm gonna do it one more time before I actually give it to my patient. I'm going to go through my entrance routine. I'm gonna wash my hands. I'm gonna identify my patient. And this is very important. Your marks that you will receive Thursday will match the band on your patient. So look, when you're identifying your patient Thursday, you're gonna take your mark and look at their armband at the same time. And their medical record number, their date of birth, and their name matches it, okay? If it does not, are you gonna give those medications?
No.
No, you're not, okay? Okay, so I'm doing that. I've identified my patient. Then I'm gonna ask my patient, and this is important. Everybody's here today except Chrissy, right? You have to ask your patient, are you allergic to any medications? Not strawberries or bananas, but medications, okay? And make sure that if they are, we have it listed, okay? Now, speaking of allergies, let's say you have listed that they're not allergic to anything, but you ask them and they say, I'm allergic to aspirin. Then your next question should be, what does it do to you, okay? If they say, well, it just kind of hurts my stomach sometimes. Is that a true allergy? No. But if they say, well, it makes me stop breathing, okay, that's a true allergy, okay? And that's something you're gonna learn in RN school, that there's different forms. Like, we're gonna give aspirin if somebody's having a heart attack. If it hurts their stomach, we're giving it anyway, okay? And then we're gonna give them something to help their stomach, but we're giving it. So I want y'all to start asking those questions. So after I've identified my patient and asked for allergies, I'm going to put my patient in that high Fowler's position because I don't want them to aspirate. I'm going to moisten their mouth with water. Why do I use water? Can y'all think of a reason why I would use water instead of Sprite? What if they do aspirate? What if they aspirate? Which is better to go into the lungs,
Water.
water or Sprite?
Water.
Water. We have water already, okay? Sprite is sugar. It's gonna turn into bacteria and they're gonna get an infection. Does that make sense? So that's why we use water, okay? Now I know some of your younger patients will say, that has a bad taste and I want Sprite. But with the elderly, it's really important to use water if you can, okay? So I'm moistening their mouth and I'm getting it moist and I'm checking their ability to swallow. And she did just fine. So then I'm going to go down the line one at a time and I'm going to explain every drug to my patient. Miss Watkins, I've got some Zofran for you, Zofran 4 milligrams. That's for nausea. You've been really nauseated, so your doctor's ordered this every 4 hours. And one at a time, I'm going to empty them. I'm looking at it one more time to make sure this matches my MAR. I'm saying it out loud and giving her an opportunity to say, no, I'm allergic to that, okay? That's why we're telling her, and we're explaining to her what we're doing. I'm putting it in my cup, and I'm giving her water, and I'm watching her swallow, okay? Something else I want to tell you about swallowing. Most patients do this. You may do it too. They tilt their head back to swallow. Really, the way we're supposed to enhance swallowing, they're supposed to dip their head chin to chest, okay? That's how we're supposed to swallow. Did y'all know that? It's weird, isn't it? It's the opposite of what we think, but we're supposed to have them do this to swallow. We make sure they swallow that before we move to the next medication. The next medication is my Vasotec. I have written down here, I need to check her blood pressure. So before I give that medication, I'm going to check my patient's blood pressure, make sure it's in the correct parameters before I give it, okay? And I'm going to tell her, I'm giving you your Vasotec, 10 milligrams, that's your blood pressure medication. Blah, 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 okay? Let's say she says, I put the pill in the cup and I hand it to her and she says, that's not my blood pressure, that's not Vasotec, that's pink and mine at home is orange. What do I say? So what, technician? No, we're going to reassure, we want them to think or to know that we know what we're doing and that we're not giving them the wrong medication. So we're going to stop and say, okay, I'm going to double check that, Ms. Watkins. I believe what's happened is we have the generic form and at home you have the trade name, but I'm going to go double check that first. And we're going to go double check and make sure that is what pharmacy has, even if it says it on the package. We want to reassure them that we're doing everything we can to give them the correct medication, okay? So the patient's always right, okay? We're going to double check. And so if I'm given potassium, I'm going to make sure that I have looked ahead of time in the chart, make sure I check that potassium level. If I'm giving a water pill, I'm going to tell them it's a water pill. This is going to make you use the restroom, have to use the restroom a lot in the next hour and a half. So I need you to use your call light to have me come assist you, or would you like me to bring a bedside commode in? You see the extra things we're going to do as nursing students to help our patients and to think ahead about what they might need when we're giving these medications. Okay, so one at a time, I'm doing that third check and saying it out loud to them, explaining what medicine I'm giving water in between every medication. Now I've given all my meds. Now how do I document that I did? At the bottom of the page, you have initial and nurse's name. In most facilities, we write our initial, LV, and then my name is LVOS RN. Okay, I don't write my whole name out. Most facilities require that. Now, you will do your facility's policy though. If you go to work somewhere and they want you to write out your entire name, that's what you'll do. But for this week and for nursing school, that's how you'll do it. Your initials, and then C. Williamson, SPN, okay? So you write that at the bottom, and then you're going to go back up to your time. You will all be giving 9 o'clock medicines on Thursday, so you will draw a line, it's like at a diagonal. You draw a line through it and put your initials by it, okay? If you held it, because the potassium level was 6, you circle it, and you're going to write K, which stands for potassium, right? K 6.0. That's all the explanation you need, okay? Or let's say you were giving a blood pressure medication and the blood pressure was 90/50. Then you're going to circle it and write BP 90/50. That's the only explanation they need, okay? But write an explanation. When y'all go to clinical next semester in the hospitals, there's a whole section over here for you to write comments, and I always want you to write, especially if you're giving a medication that affects a vital sign. I want you to include what your patient looks like. Like, you're going to say, BP was 130/80, patient awake and alert with no complaints, okay? So it lets everybody know you did an assessment. You actually looked at your patient and checked their vital signs before you gave that medication, okay? Okay, that's it. So you're not finished with your skill until you've correctly documented that you gave these medicines or withheld them, okay? And remember what I said about if they refuse, I want you to ask them why, okay? Because and your instructors might throw that at you. That, well, it hurts my stomach, or I'm not sure, I don't really know if that's the right medication. Then we're gonna say, well, let me go check for you. Let me go get my supervisor, blah, 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 okay? We're gonna try to talk them into taking the medication. If they, okay, let's say you're given a medication and you drop it accidentally on the floor. Are we gonna pick it up and give that medication?
No.
No. What if you have your package out of your little Ziploc and it's already partially torn open? Are you gonna give it?
No.
If it is crushed inside, are you gonna give it?
No.
If it is expired even by 30 minutes, are you gonna give it? No. We don't give expired meds. We don't give any that have been tampered with. If they are, if they're broken inside the package, we don't give them, okay? And if I had prepared all this and I get into the room and she says, honey, I've been constipated for 5 days, I'm gonna be here a while, Missy, or am I gonna leave them in the room?
No.
No. Take them back out, lock them back up, okay? So if y'all can remember all that, you're gonna do just fine, okay? You'll all have about 5 or 6 medicines to give. Oh, I need to include something else. And then one of them will require a dosage calculation, okay? So please be prepared. If you're not prepared to check off, don't waste our time. I mean, really, if you don't know the patient's 5 rights, we're not going any further, all right? I want to talk to you briefly about 2 simple things, 2 other things, and we're done. Liquids. If we're giving a liquid medication, it's going to be it's either going to be in their box outside or it's going to be in the nurse's station. So our first check is when we pull it out of the box. We're looking at what it is. Our second one is when we're comparing it to our MAR and when we pour it, okay? And the third check is one more time before we put it back up. Can y'all remember that? So our checks are a little different on liquid. Your book tells you to do it one way, and I'm going to tell you that's not the correct way. When we open a liquid medication, of course we're going to palm the label to protect it. All right? We're going to pour it, we're going to put it on a flat surface, not hold it at eye level like your book says. We put it on a flat surface, we go down to it and measure it there. Okay, I'm going to go ready to pour it, and I'll pour 1 teaspoon. I'm going to take a tissue and clean off the outside of the bottle before I put the cap back on it. And look at it one more time before I put it back up. Okay, so that's how we pour liquids, on a flat surface, not at eye level. Oh, that reminded me of something else I want to tell you. If that liquid happened to be a cough syrup, we give that last, okay? If you're giving all these PO meds and a cough syrup, we're not supposed to give water after a cough syrup. Did y'all know that? People do it, you know what? People do it all the time because it tastes bad, doesn't it? But we're not supposed to. It dilutes it, so we're supposed to give this last and without water, okay? All right, so there's something else you learned today. One more thing and we're done. If you have to give, no, 2 more things and we're done. All right, if you're gonna give it out of a multi-dose, and y'all will, okay? These are my mother-in-law's that when she left Encore Rehab, they gave them all to us, so I thought, I'm gonna use those for our checkoff. So you go to the day, they have the days of the month listed, so you go to that day, and if it was given several times a day, you might have several on that day, okay? And you're gonna put it directly over your cup, and you just punch it out, okay? You have to be very careful, make sure it's under there, and you just punch that out, it goes in there, okay? So that's how we do it out of our multi-dose one, or individual supply. If you have a multi-dose bottle, we do it like this. We tap out 1 tablet into the lid, And every semester, students say, why? I don't know why. That's just the way we've always done it. So I don't have an answer for you. But we just tap it out into the lid, like this. And I promise you, when you do this Thursday, five will fall out, not just one, because you're gonna be nervous, like that, and so 5 are gonna fall out. So we just tap out one. Just doing it to me, and I'm not even nervous. Okay. We tap out one, and then we put it into our cup, okay? It'll work just fine Thursday, I promise. All right, so that's how we do it. We tap it into the lid, and put that into there, all right?
So what if we do that valve for the
It's okay, it's all right, we'll work it out. We'll let you, put it back. All right, I think that's everything that I needed y'all to know. Oh, no, one more thing. I saw a pressure thing, it reminded me. If you have to give, let's say you do your dosage calculation, and it says that you're supposed to only give 1/2 of that tablet. I'm telling you, you get your pill splitter out. You will have them everywhere we go with the students. We have a pill splitter. You'll do it right then, okay? Because you'll forget when you get to the bedside, and then you're going to make a medication error, okay? So if you've got to do a dosage calculation, number one, are you doing it alone? No. You're going to get a second nurse. Verbalize that for your checkoff. That when you did your dosage calculation, you're going to double check with a second nurse, and that if you've got to 1/2 a pill, 1/4 a pill, any of those things, you're going to do it right there, okay, before you enter the room, okay, so that you don't forget. All right? Any questions? Are y'all confused about any portion? Yes, Caitlin?
When you were doing the COTO or the liquid, say it was the wrong liquid and but you already poured it out, you would still waste that, right? You would pour it back in the bottle.
You would not put it back in the bottle, you're right.
What would we do if we only needed 1/2 the pill with the other 1/2? Would we waste that?
We waste that, okay? Now, that's really changed. You know, used to, I have poured so many, I have put Demerol and morphine